Hello, I am Tu Kim Lam. Welcome to the Medical News. In this edition of the Medical News, we will talk about hemorrhoids. Hemorrhoid is common health issues, not only for men, but also for women, and not only in the Vietnamese community, but also in American communities. Here with us today is Dr. Sang Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will share with us the basic information on hemorrhoid and the latest procedure. Please welcome Dr. Sang Tran to the Medical News.
Hello and welcome to our medical news today. And again, hello, Ms. Lam.
Hello, Dr. Tran. Today we're going to talk about hemorrhoids. But first of all, would you explain to our audience about the structure of the anus, where is the hemorrhoid start?
I will present to the audience some basic understanding about the anus, or the rectum and the anus, because they're so close. If you look at the pictures on the screen, you can see the anus is the last part of the colon. And then above the anus is the rectum, and then the sigmoid colon. If you look at the structures of the anus, is so important because they need the support of the pelvic muscles. The pelvic muscle will form the protective layers to protect the anus at the last part of the abdomen. At the same time, they form a sphincter. This means the sphincters is to help the anus to do the job is to really doing the contractions or relaxations of the anus during the defecation. Now, but if you look at carefully at the inside, the anus, you can see a special layers of the veins. We call hemorrhoidal and venous plexus. It's how much important because this plexus is forming a cushion for the anus to close tightly the anus when really we don't do the defecation. And if you look at further, most of the veins from the rectum on the anus will go back to the main veins called portal veins. They will go through the liver, and from the liver, they will divide, distribute, and go back to the heart. So anything really causing obstructions or decrease the blood flow from the rectum to the liver will trigger the hemorrhoid. We trigger the dilatation of these veins. So therefore, the hemorrhoid was defined by the dilatation, swelling, and all inflammations of the venous system of the anus. Now we decide to this two groups. It depends on the anatomy of the hemorrhoid. If you look at carefully at the rectum, you can see the line, called dentate line, that would divide the real rectum with the anus, because the anus have very sensitive, they causing pain. But beyond the dentate line, patient really did not feel anything. So we divide the hemorrhoid into two groups. The internal hemorrhoid is go beyond the dentate line, and the external hemorrhoids is go beyond to the external part of the anus.
Dr. Tran, so what are really actually the function of the rectum or the anus?
The functions of the anus is basically combined with the rectum will help us with the defecation. I mean, whenever we decide to go to the bathroom, and then the sphincter will relax and let it loose, so we can force the stool to go through the anus. Besides the function, during daily activity, whatever we do, the anus still very close tightly. It doesn't let anything come out of the anus, including gas and liquid. But if you're losing that function of the anus, you can see the whole thing is completely abnormal. People may leaking fluid or leaking gas anytime, or if the person losing the brain control, they also losing completely the control of the anus or control of defecation. So we call it incontinence of stool.
Dr. Tran, this disease is happen to not only, it's very common, and it's not only happen to men, but also in women. So what actually is the cause for this hemorrhoid?
If you look back at the structures of the anus, you can see anything that causing obstructions or the interfere with the flow of the blood from the rectum to the liver will causing hemorrhoid because it build up the pressure inside the vein and causing dilatation of the veins. The same thing with your legs. When you have varicose veins, when you stand up too long and sitting too long, the vein will really build up the pressure inside and causing swelling and causing some edema of the legs. The same thing with the rectum and anus, when the pressure build up. For instance, when you try to strain yourself, the build up pressure, any obstructions from the venous system during pregnancy, the heavy baby, the pregnancy, the slow motion, the constipation also causing this. People who are sitting a lot at work, people usually have the habit of staying too long in the toilet room, usually may have the problem. And also people taking some medication that causing constipation also. And also people with liver problem, especially cirrhosis of the liver, they may develop obstructions from the liver, blocking the venous return and causing more dilatation of these vessels in the rectum. And therefore, they always develop hemorrhoid. The same thing with the ladies with the pregnancy. And lastly, people eat less fiber, and they really don't have much constipation, but every time they move, because the stool is so small and thin, they have to force themselves to push on the stool out. Therefore, it's easy for people who really doesn't eat much fiber to develop hemorrhoid.
What are the signs or the symptoms of this hemorrhoid?
The symptom is very easy to recognize because most people, they come up with the complaining is, I see blood in the stool, either a small amount with the toilet paper, or they just huge amount suddenly come out from the rectum because of ruptures of the venous of the hemorrhoid. And people sometimes scared and they have to go to the hospital because of the severe bleeding. Or people may have pain because when the hemorrhoid develop complication, develop the clots, they may suddenly feel pain and have something protruding outside of the anus, or just irritation, always itching, always something wet in there. So this is basically bleeding, pain, and irritation of the rectum. That's just suggesting of something wrong with the anus, and most likely it's just the hemorrhoid. But remember, not every rectal bleeding relates to hemorrhoid.
So how do you make a diagnosis of this hemorrhoid disease?
For the physician to make the diagnosis is easy. Sometimes the patient, they make their own diagnosis and mostly correct. But easy to, based on the information, the physician can look at that, do the exam, they can find. The more difficult part is when people come up with the internal hemorrhoid, when they don't see anything outside of the rectum, then they have to do the exam. If not, they have to do the procedures called cystoscopy, and they use the equipment to take a look at the inside. Not too far, usually they come up to about 50 centimeters. That's enough to look at everything is around the anus and the rectum. But if they're concerned about something else, like cancer of the colon or any other special disease like Crohn's disease and chronic inflammation of the bowels, and then they have to go through the colonoscopy. This means to take a look at the whole pictures of the colon.
Dr. Tran, due to the nature of this symptom of this sickness, it's in a very private part in the body. So a lot of patients is embarrassed to go to the doctor to seek for treatment. So what happens if they wait and delay, prolong the process of treatment? What are the complications that they will get if they wait to treat the hemorrhoids?
The complication usually depend on how long the patient develops the hemorrhoid. And then there's how much blood they may losing when they have bleeding. Somebody they ignore it because they feel like they don't have much symptom, they have some little blood here and there, but later on they may develop anemia. This means it's the low in blood count because they're losing some blood. And the other complication is very common is when they develop severe pain in the rectal area. Could be from the clots forming in the venous plexus of the hemorrhoid and causing more pain, or they may develop some kind of infections. On top of that, when the area of the anus due to the laceration or the fissure, the crackling of the mucosa that trigger more infection when they still have a lot of bacteria that get into the system and causing inflammation or swelling and sometimes causing infections such as abscess of the anorectal area. And that's basically these complications that mostly happen for people really. There's no evidence of the hemorrhoid may trigger cancer later, but it's mostly related to complication due to pain, infection, and the anemia.
I understand that hemorrhoid have different stage, from mild to severe. Would you talk a little about this? How many stages of hemorrhoids?
The staging of the hemorrhoid grading is important for the physician to decide which treatment approach they have to use. But it's really easy to remember. Really, is most of the patients, they may know the grade of their problem. The grade 1 means really they don't see anything. They get some blood in the stool from time to time, and it's go away, and no pain, nothing. And grade 2 is when they see the hemorrhoid or the packet of hemorrhoid may protrude beyond the anal verge. But then the hemorrhoid will reduce spontaneously after the defecation. So only when they strain, they can see something come out. But after they finish with defecation, everything come back. The grade 3 is the hemorrhoid protrudes spontaneously, but it cannot come back by its own. And then the people have to use the finger to push it back inside. And lastly, the grade 4 means the most severe, when the hemorrhoid come out completely, and so many packets of the hemorrhoid, and also a little bit mucosa from the rectum also come out and causing prolapsing of the rectum along with hemorrhoid. That's grade 4. Mostly, they need surgery to fix that problem.
What are the treatments that are available nowadays for hemorrhoid?
Basically, a 3 forms of treatment that we need to know, especially we will already have hemorrhoid. Number 1, you have to change the way you eat and the lifestyle. And secondly, is medication. And thirdly, most of the surgical treatment. And surgical treatment have different form. It's just we call the very minimal invasive procedures. They don't need much the anesthesia, maybe local anesthesia. The other they call total hemorrhoidectomy, hemorrhoidectomy. That's mainly to remove completely all the hemorrhoid by using the surgical approach. They need to prepare for the patient, needs general anesthesia, and need a long time for the patient to recovering from that, because they do a lot of invasive procedure in that to treat the hemorrhoid completely.
Are you talking about nutrition and lifestyle changing? Can you please explain what you mean?
The diet is so important, and changing lifestyles is the key of the success for long-term treatment of hemorrhoid, because the people really have constipation will develop hemorrhoid. Therefore, they need to eat more vegetables and fiber, any form. Especially dark green vegetable, because the dark green vegetable like broccoli, Chinese broccoli, any other Asians and vegetable, if it's dark green, usually we can use it, because the dark green is provide more fiber and also provide the vitamin K. Vitamin K have the protective effect and for forming clot to prevent from further hemorrhage. So that's why we advise people to eat more dark green vegetable. You need to drink more fluid, because drink more fluid make the stone softer, easy to move, need to strain, and exercise. And also exercise because it's build up the strength of the colon and the muscles, the pelvic area, so they can really doing the defecations easily if they strong. And completely different with the elderly people. Sometimes they don't have enough strength to force themselves to strength to push the stool out. Now, in the changing lifestyle, there's one approach that we can use that called warmth path. They use the hot or warm water in the more small container, and or you can use the bathtub at home and using warm water and just using that and put the hemorrhoid area into that area, because it may help with people really acute pain, because it may relax the muscles, relax the sphincter, and having more circulation going on to that area. So this is some basic things that people need to do when they have to deal with the hemorrhoid.
We're talking about food and nutrition and lifetime changing. Let's talk about medication. What are medications that are available nowadays for treatment? And secondly, a lot of people tend to go for alternative medication, example like herb medicine, and a lot of them is advertised on the internet and without doctor prescription. So how effective are these medications, sir?
Well, so far for Western medicines, the only medication is proven to be effective is the hydrocortisone with the high concentration. Usually we use about 2.5% because the cortisone has a spatial effect that reduce the itching, reduce the inflammations, and also may causing vasoconstrictions. That means when people are bleeding, they may causing on the small tiny vessel to constrict to stop the bleeding. That's why a lot of people, they're still using that as the tool to reduce the bleeding. Now the medication sometimes they mix up high cortisone with the other local anesthesia like lidocaine or different medication to forming the combination, so they can use different effect of the medication. For the old Eastern medicines, and people also using the same thing, and they also using herb with a lot of vegetables and some dark green vegetable. And some of them is very popular in Vietnam. They call yap cá. It's also serving in vegetable for we are to eat, but at the same time they have the effect of helping reducing the symptom of the hemorrhoid, especially bleeding. So most of the people in Vietnam still rely on these. Every time they have a hemorrhoid, they will eat these vegetables. I think it's just very useful because the yap cá will provide more fiber and also vitamin K for them. So this is basically the rest of the other alternative medicine. I think is also focused on the same thing. They promote increasing the fiber and using different kind of herb, and with the same principle, and provide fiber and provide vitamin K. That's the medication. This approach really doesn't cure the disease. It only relieves some symptom and just helping in the acute phase of hemorrhoid only. It's no proven that it can cure or really successful in get rid of the hemorrhoid.
Let's talk about the last option that we have. Can you tell us some of the surgery procedure for hemorrhoid?
Well, surgical treatment, they have two groups that we need to talk about. The first group is very light, called non-invasive, minimal invasive procedures, which include the sclerotherapy, rubber band ligations, or coagulations. And then the other big group is completely hemorrhoidectomy. Hemorrhoidectomy, and this remove completely on the hemorrhoid by using general surgery and needs anesthesia to prepare the patient. And after the surgery, they call post-operative care as well. And beyond that, we have some new technology. Well, to mention about that because right now with the technology, they advance to treatment of hemorrhoid.
What do you think of laser surgery? How safe is laser?
Well, before we go to the laser, I think we have to go through a little bit some basic treatment, less invasive. The first group is sclerotherapy. This means they use the injections of the steroid with the chemical that destroy the hemorrhoid. Very old traditional way has been using for a long time, and people don't use much nowadays except in the underdeveloped country when they don't have any other procedure or treatment protocol. They may use that. The second group is very popular rubber band ligation. If you take a look at the pictures on the screen, you can see first they use the instrument called anoscope and go through the anus and looking for the hemorrhoid, and then they will insert the small rubber band at the roots of the hemorrhoid and then tighten up, and then the hemorrhoid will be formed up in about 10 or 12 days. The problem with that is sometimes causing pain, and need to repeat to another area of the hemorrhoid. Sometimes people need to do 2 or 3 times before they can get rid completely of the hemorrhoid. But it's so simple, only need to repeat the procedure. The other procedures they could use coagulation. They can use either infrared, using temperatures to destroy the hemorrhoid. They use laser, or they use the cold temperatures, they call cryotherapy, to bring the temperatures down to less than 40 degrees below zero, and also the same principle to destroy the hemorrhoid. So really, to answer the question is whether the lasers is better or have some side effect. The laser really proven to be better than the other coagulation processes, and this is more expensive. But the good thing about lasers, they can do precisely how much they can give and how deep they can give and everything like that. So the laser still has some benefit, but it's, for the outcome, it's still not really much different the way we treat people with the coagulation procedures.
If a patient have the surgery, after the surgery, will the hemorrhoid recur?
Well, mostly surgery is the best because the incidence of recurrence is much less compared with the other minimal invasive procedures. So most people, they don't really need to repeat this surgery, but they may develop some kind of complication because the anus becomes smaller, becomes scar, they call it strictures, and they may have a hard time to move the stool. They have to use some softener or thing like that. It depends on how severe the problem of the hemorrhoid. If the hemorrhoid is so big, they do a lot of surgery, and then the anus become a little bit smaller. It causes strictures of the rectum.
Are there any new procedure for hemorrhoid nowadays?
The best right now that we're going to talk about is the procedure using ultrasound. They call hemorrhoidal treatment system. They have the equipment with the ultrasound at the end. They insert into the anus and looking for the hemorrhoid, and using ultrasound system to identify the vessels, the artery that provide the blood flow to the hemorrhoid system. And then they either tie up or they just cut off the circulation, and other for the hemorrhoid to be collapsed, and it's just losing the strength and dilatation, and will go away and get better. That procedure has been going on for maybe 2 years and most popular in the Florida area. But the newest one we're going to talk about is called bipolar forceps, or HET, bipolar forceps, called hemorrhoid electrocoagulation technique. Because they use technology, they use the instrument that connect directly to the radio frequency electricity system. They go to the hemorrhoid, they have the forceps, they clamp the hemorrhoid, and using an electrical system radio frequency to burn that hemorrhoid. So this is simplest form. People thinking this is simplest, they can do very fast. They don't need general anesthesia. And right now, there's currently a study in Cleveland clinic area, and hopefully they will give us the results in about the end of this year or next year in 2014. To see, this is the disposable instrument. People can use it and then they throw it away. So simple, they just connect with the electrical system and burn it in the office. So I think this could be the very popular procedure we can use in the future.
Dr. Tran, before we wrap up this medical news today, do you have any word of advice for hemorrhoid patients?
Well, basically, remember, we're talking about the underlying causes of hemorrhoids, basically constipation. So you have to eat more fibers, more vegetable, and drink more fluid to avoid that. And try not to really spend too much time or sitting too long in one place or stand up one place for a long time. Keep moving exercise to move the system and increase the strength of the colon. For pregnancy, I think ladies need to be careful when they get pregnant. They have to follow instructions to avoid certain kind of constipation during the pregnancy. Basically, this exercise always is a good advice for everybody.
Thank you, Dr. Tran. That was all the time we have for the medical news today. Thank you for joining us.
Thank you for watching our shows today. And again, thank you.
You're welcome, sir. That was Dr. Sang Tran, who just shared with us the information on the hemorrhoid and the latest procedure to treat this disease. We hope this information provided by Dr. Sang Tran has shed more light on the hemorrhoid issue. That is all the time we have for this medical news. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News.